right, we're going to be looking at the cardiac cycles. The cycle of events described here almost happen kind of simultaneously, but not really. As you can see from this wonderful diagram, and I've put the link for it down below, they're all different, okay? So we're going to focus on the left side of the heart, beginning with the activation of the atria. We're going to look at atrial systole and diastole. Here we have the wonderful P wave. This is the boss. She just starts it all. Mrs. P wave over here reflects atrial depolarization, which then initiates atrial systole. Why do we need to know if this is atrial depolarization or if this ventricular repolarization? Why do you need to know this? Because it's going to come up in your exams. But I'm going to teach you guys an easy way to know this. Look at this. PAD, PAD. P wave, atria depolarization. TVR, TVR, T wave repolarization. So when it comes up on an exam and they ask you where on the ECG does the depolarization occur, you're going to know, PAD, P wave, atria depolarization, and you'll be able to answer that one very quickly. Okay, if the exam asks you where on the ECG does the repolarization occur, you're going to be able to say, TVR, T wave ventricular repolarization. See, guys, you would have gained 2 points right there. This is important. I have seen it plenty of times. So just a study tip. Take it or leave it. But I would definitely memorize that one. Okay, so the P wave of the ECG simply reflects atrial depolarization. So what does this depolarization mean? Let us simplify this. I know it's big words, okay? But let's look at it, as in depolarization. It's just changes that are occurring within the cell. The charges are changing within the cell, okay? There's changes. And you could say, to make it easy for you, that the cell is preparing itself, because look at here. Look at the P wave, and then look at what's about to kind of happen here, the spike that occurs here. So you could say that during depolarization, there are changes that are occurring, rapid changes that are occurring, which inside the membrane of the cell, which normally are negatively charged, but now they become positive, and on the outside negative, okay, which is important. Why? Because this cell is changing and preparing itself to charge. It's preparing itself to act, okay? It's preparing itself to move. So there needs to be changes, right? It's just like when you're preparing to run a marathon, right? Right before the whistle is blown, you're already preparing yourself, your mind, your body, your physique. You prepare ahead of time. So this is what is happening during the P wave, during atrial depolarization. There are changes within the cell membrane which are going to impact the charging of that cell, which will allow that cell, right, to do what it needs to do here. I hope that made sense, but that's as much as I could really break it down. My husband will do a video on action potentials, and he will go more in depth with this subject. But for now, I just want you guys to just understand this. What I told you is what you need to know. All right. So contraction of the atria tops off, and then there's this thing called ventricular filling. So this atria contracts, right? And then all of a sudden now the ventricle begins to fill up with a little bit of blood. Okay. Under resting conditions, atrial systole right here during this resting period where the ventricles are filling up here. Do you guys see this? Under normal conditions, atrial systole is not really needed for the ventricles to fill up. You guys know where the ventricles are, right? Look, okay? It's not really needed for the ventricles to fill up with blood, okay? However, when increased cardiac output is required, the atrial contraction, right, becomes even more important. In other words, if I'm gonna run a marathon, okay, my atria needs to contract. Atrial systole needs to be working appropriately versus if I am sitting at home not doing anything. So in school or at your job, you've seen what happens when a client is in AFib, right? The heart rate is pumping 150, 140, 120, 100, whatever it is, 10. The rate is just kind of all over the place. The P wave here is not synchronized, meaning that it doesn't happen like PQRS. PQ. The P wave is all over the place, right? So when that occurs, when there's no synchronized beats of that P wave, right, movement of the P wave, the ventricles are not able to fill up with blood, okay? And this happens a lot in those same patients who have AFib, whose atria do not contract synchronously. The P wave is supposed to be followed by an electrically quiet period. This is the Lala period. So you've got this P wave here, and then you've got this resting period, the sleeping phase. During this quiet period, right, which the AV node transmission occurs, the PR segment. So, guys, when they ask you, what is going on here? If they ask you about the PR and they say, what's going on? You could tell them, oh, it's something about the AV node. The AV node is doing something here between the P and the R. That's what we want you to know for now, okay? During this electrical pause, the mechanical events, this electrical pause right here, guys. Let me grab something on here because I'm gonna grab, what color should I use, guys? Okay. Boom. Do you guys see that pause right here? Let me make it more, I kind of covered everything. Oh, there it is. All right. So during this electrical pause, the mechanical events of the atrial systole and ventricular filling are concluded before the excitation and contraction of the ventricles, voila, begin. Okay? Atrial diastole is here, is followed right after by atrial systole. Okay? And while at the same time, you can see that ventricular diastole is ending and ventricular systole is beginning simultaneously. So what are we saying here? As the left atrium relaxes, blood enters the atrium from the pulmonary vein. Simultaneously, blood enters the right atrium from the superior and the inferior vena cava. The gradual rise in left atrial pressure during left atrial pressure, think about that, okay, during atrial diastole reflects the V wave. The small pressure oscillation early in atrial diastole is the C wave. It's caused by movements of the heart associated with ventricular contraction. OMG, what did she talk about? So let's go back and let's rewind and let's talk about this some more. Okay, so what did we learn today? We have our pad. We've got our pad, right? The P wave atrial depolarization. And what is happening during this depolarization? Why is it important for that? Well, the ventricles are filling during this phase, right? This is important because this is when, based on this P wave, we will have this nice resting phase where the ventricles will begin to fill up with blood. If this P wave here is not is not organized, is not on time, is bizarre all over the place, right? Then what we have is not enough blood filling up in the ventricles. And later on, you'll get to find out why that is important. So why is this important? Why do we need this P wave to act the way it should act? Well, because we need that P wave. We need those ventricles to fill up. We need enough blood to get in there. Versus when the heart is not relaxed enough or within enough time, not enough blood is filling up, right? That means not enough blood will eventually be pushed out of the heart to the body. That is a problem, and you're going to learn why over time. We're going to go through it. But what did we want you to learn for today? Because as we move forward, it's going to get more difficult, right? PAD, P wave, atrial depolarization, TVR, T wave, ventricular repolarization. So once you know which one it is, you'll know how to answer it. Okay? So what happens during atrial systole and diastole? The atrial contraction is what forces blood into the ventricles. We need the atria to contract so that blood can enter into the ventricles. It's absolutely important, right? Well, at the same time, during the atrial depolarization, it's a phase where we have atrial diastole and systole, and we've got ventricular diastole that is ending while ventricular systole is beginning. It's a lot going on, right? But I think you guys have kind of gotten to know. So if I ask you, hey, when is the atrial systole? When does it begin, right? Or when does atrial diastole begin and end? You're gonna think back and you're gonna think, oh, PAD, P wave, atrial depolarization. So atrial systole is happening during the P wave on the ECG, right? And right before the QRS, or during the P wave, right? Right. Atrial diastole and atrial systole occur during the PQRS side of things, okay? And the P wave is very, very important for atrial depolarization. We need the atria to contract because contraction forces the blood into the ventricles. All right, guys, catch me on another segment. Bye-bye.